Hello, everyone. Good evening, good morning, good afternoon. I don't know where you are. Welcome to another webinar from Everything MRI and the Fourier crew. Julian, I know you're in Italy. I'm in Portugal. So hello to everyone. I'm glad that we have so many people here today on MRI Safety Week to talk about AI in cardiac MRI. Today we have Daniele, and I will let Daniele introduce himself in a little bit. First of all, I just want to make sure everyone understands the rules of these webinars. Most of you I can see have been here before, so I just will ask you not to put your mics on, don't turn your cameras on, and make sure that you let the presenter talk throughout the whole presentation without any interruptions, and we'll just talk about anything you have in terms of doubts by the end. So you have a Q&A box and a chat box that you can use. Me and Julian will take all those questions and we'll ask Daniela at the end. But of course, use and abuse the box. Just tell us what you want to know, and we'll discuss more or less at the end. I'll have my own questions. I'm sure Julian has his own questions. So yeah, let's have a fun night once again, and I hope you all enjoy. Julian, I'll pass it to you as well for some words from your side.
Thank you so much, and thank you everyone for being here today, despite being probably one of the hottest day, at least where we come from in this part of the world at the moment. And you could be somewhere else sunbathing, but you decided to be here with us to listen a little bit more about AI and cardiac MRI, which is an honor, I think. I completely echo what Sam says. Little reminder also not to draw lines or anything like that, just to make sure some own sake and safety, so he don't have to kick out anyone from the room. And what else? Well, just obviously Daniele is going to introduce himself, but I just want to praise him one moment because he's just completed his own master at City University of London with a beautiful presentation, with a beautiful dissertation, which turned into a presentation, which is what we are going to see tonight. So this is going to be a fantastic work, which is going to end up with a publication. So I'm very proud of what Daniele has achieved, and I just want to leave the stage completely to him.
Hello, good evening. Can you hear me okay? So my name is Daniele Silipo. I am an MRI cardiac radiographer. It's a great pleasure to be here this evening. First of all, I would like to thank Samuel and Julian for giving me the opportunity to be here to share my project. As Julian mentioned, this was my Master of Science project that I done last year that is focused on the application of artificial intelligence in cardiac magnetic resonance imaging. So should I share the video?
Yep.
Okay, it should be here. Sorry. Let me know if it's working fine.
Yeah.
Second. Okay. Is he
Perfect.
good?
Perfect.
Awesome.
Awesome.
Okay. So tonight I'm going to discuss about this project that was a systematic review that I've done last year about the application of AI in cardiac magnetic resonance imaging. The way I would like to discuss about this is by giving you a little bit of the background as well as the structure of the work. Then we are going to discuss more in depth about the application of the AI algorithm because I think that is the most interesting part. And I decided to expand a little bit about the topic because I think will be interesting to discuss together about the future of our future as professional, considering the advent of AI. I put a little spoiler here. You may have seen this image on LinkedIn. This is from one of the algorithms that I'm going to discuss in a few minutes. And this is one of my favorites. I think is particularly interesting, and I'm going to explain why in few slides. I have nothing to disclose. And as an introduction, I'm not sure who does CMR, but cardiovascular magnetic resonance imaging is a very effective and non-invasive method of assessing heart anatomy and function. It is considered the gold standard for ventricular function, and it can measure different variables of the heart, such as ventricular volumes, ejection fraction, strain, and myocardial wall defects. Is a very powerful tool. In our clinic, we do a lot of CMR examination. We also do stress perfusion, where we inject a substance that increases the heart rate of the patient a little bit so we can see the perfusion of the heart. So there's many application of CMR, but it does come with some challenges. Some of them are quite obvious because at the end of the day, we are taking picture of an organ that is constantly beating and is inside the chest of the patient. So we have a lot of challenges that are related to arrhythmias, the inability of the patient to hold their breath. We have, is quite a long scan, 45 minutes to an hour, even more. So the patient may move during the scan. Therefore, we have a lot of artifacts that arise from respiratory motion, irregular heart rhythm, blood flow turbulence, and also magnetic field inhomogeneity. Considering the amount of artifacts, we may have to repeat the sequences, extending even further the examination time. I would say that the skills of the radiographer is quite important in CMR. It is always important, but in CMR is particularly important because of these challenges. So let's see how artificial intelligence, AI, can help us to overcome these challenges related to CMR. Generally speaking, artificial intelligence refers to computer system that can perform tasks that typically require human intelligence, such as learning, decision-making, and pattern recognition. Nowadays, we are surrounded by AI. I believe most of us are using on a daily basis ChatGPT or similar. I have a colleague that uses ChatGPT all the time, but I'm not going to mention the name. For example, we have this image that was generated by AI. So here we go. The aim and objectives of this study, I already touched a little bit on them, is to review and evaluate the existing application of AI in CMR and how AI algorithms can be implemented into CMR pipelines, mainly to improve image quality, but we're going to see other application of AI. I've been discussing about the challenges. We're going to review some of the AI algorithms, describe the limitation, and we're going to discuss also about the future opportunities and our future as radiographer because of AI. I'm going to speak briefly about the methods. We follow the Prisma and the PICO framework. We've been analyzing different databases such as PubMed, Google Scholar, 𝐼𝐶IV, and the Cochrane Library. Different keywords and Boolean operator to filter out some of the studies. We've been creating eligibility criteria. We've been assessing articles from 2019, 2024, English, full text, focus on AI and CMR. Based on a thematic analysis, and we perform a bias assessment using the CASP tool. I would like to mention and thank Julian for helping me in this process, but we're going to discuss maybe later about some other aspect of the study. And okay, let's jump into the results. And I would like to present these studies and the AI algorithms now. We have been including 31 studies from different countries, and UK is at the top, which is great. The main design was a technical development and validation study. We've been observing different scanners, mostly Siemens, GE and Philips 1.5. I decided personally to focus on 1.5 Tesla because is where we have the bulk of the CMR examination, even though we perform on 3 Tesla and other field strengths as well. On different sequences as well, the main one was the balanced steady state free precession. Of course, there was a lot about CNA imaging, but there were some interesting articles also related to T1, T2 mapping and CMRA and more. This is a diagram of the selection of the studies. I decided to split the studies in 4 categories because I wanted to have a better structure in this project. So we're gonna see those categories, starting with the scan acceleration, reducing the scan time and the breath holds. Then we're gonna discuss a little bit about artifact detection. I think this is particularly interesting, mainly focus on motion artifacts, but also others. AI can also reduce the artifact automatically. I'm gonna show you some example. And another interesting one is image reconstruction to improve image quality from raw data. So I also presented a table just to show you what kind of AI algorithms we've been analyzing in this project. The main one was the convolutional neural network for all the categories, but we've been observing also variational networks, deep meta learning, and more. I'm not going to touch on all of these AI algorithms because I think it would be more interesting to see the application on the images. But I would like to discuss a little bit about the convolutional neural network for the simple reason that they are the building blocks of most of the AI architecture out there. So they're quite important. And the reason is that they are particularly good in analyzing pictures and recognizing patterns. So what happens? The convolutional neural networks are characterized by different layers. In the early layers, the AI, instead of looking at the whole picture, extract features like texture, the edges, and the shape. Going in the middle layers, we have a better understanding of more complex shapes. And in the deeper layer, the AI is able to recognize pattern. In this example here, we can see that the AI is learning on how to segment the left ventricle. So we have an automatic segmentation from the eye of the left ventricle. So the eye is learning the pattern and can outline the contour of the ventricle. So the way I would like to present to you the AI algorithms is by simulating a CMR examination. I thought would be a good idea, starting with the acquisition from the patient perspective. So basically, I would like to see what AI can do to help the patient, to help us to obtain good quality pictures. Then I would like to focus a little bit more on the scanning, so our perspectives as radiographer, how can AI support us in the scanning process? And then I think will be interesting to see also some application about the reporting process because it's part of the whole examination. And then finally, we're gonna analyze the integration of AI in the entirety of the workflow. But let's start with the acquisition from the patient perspective. What can AI do to improve or to help the patient to collaborate with us? As I mentioned at the beginning, the CMR examination is quite lengthy and we have a lot of breath holds. So I would say that the best example is scan acceleration, including breath hold shortening. So in this study by Kastner et al. 2020, we have a reference short axis of the heart. The 2D cine is the gold standard with multiple breath holds for a scan time of 260 seconds. We also have a 3D cine as a reference, single breath hold, so one shot, 30 seconds. And with these 30 seconds, we can acquire the whole left ventricle. But as a breath hold, 30 seconds is quite long, I would say. I would struggle myself as well. So what they have done, sorry. In the panel B, we can see the application of different reconstruction technique. We have different acceleration factor, 9-fold at the top, 11-fold in the middle, and 15-fold at the bottom. Then we have different reconstruction techniques. The zero field on the left. Zero field is just a mathematical reconstruction where we literally add zeros in this K-space where the data is missing. So we are not adding any new data. And we can see that the quality of the picture is not particularly good for all of these acceleration factors, is noisy, is not a good quality acquisition. In the middle, we have the component sensing that we know about. And again, the quality of the pictures is not very good for all of the acceleration factor. And finally, on the right side, we have our CNNet, which is the AI algorithm. And you can see that if you focus on the last picture at the bottom, for a 7 seconds acquisition, 15-fold acceleration, the quality of the short axis is not bad at all, is actually comparable to the 30 seconds acquisition of the 3D CNNet. I would say that analyzing this 12 seconds acquisition, the image of the CNNet is arguably even better than the standard 3D CNNet. So this is to say that if we have whole patients or patients that have lung diseases, for example, having the opportunity to have a 7-second single breath hold to acquire the whole short axis of the left ventricle is definitely a great improvement. I have a very quick animation of this just to show you how it should look like. Hopefully it will start. Oh, let me try again. Okay, I think there's an issue with the video, but basically we can see that better in this picture that the CNNet acquisition is improving on the 30 seconds reference picture. Okay, let's check the scanning part, which I think is the most interesting one, because we can see how the workflow from our perspective as radiographer can be improved massively, I would say, from the AI integration in the workflow. And as I promised at the beginning, I'm going to discuss about this specific algorithm, which is my favorite one. Never thought I would have a favorite AI algorithm, but I do, and is this one. And the reason is because I think it fits well with different scenarios. So what we have here is the artifact detection from the AI. What this really is actually a quality assessment of the picture and is live. So there's a constant feedback between the radiographer and the AI about the quality of the pictures. So for example, here we have a 2-chamber acquisition of the heart, and the AI is telling the radiographer, look, there are multiple issues with this image. The quality is not particularly good. But not only does that, but it takes a step further. It tells you what is the actual problem with the image. And in this example, there are issues with the misplanning, so the planning is not correct, and also with arrhythmia breathing. So what the radiographer can do is to go back to the parameters and the planning. In the picture in the middle, the radiographer adjusted the planning, and the AI is giving the thumbs up saying, okay, you fixed the planning, very good, but you have still issue with the arrhythmia breathing. And radiographer can go back to the parameters with a good planning and using, for example, arrhythmia rejection or something to fix the arrhythmia, and the AI is giving the green ticks saying the image is good quality, is diagnostic quality, well done. And I would like to show you how it would look like in an interface. So, because I think this is particularly interesting. So basically, this is from a Siemens 1.5 era, I believe. And we have the radiographers, that is the radiographer that is taking the pictures of the heart. And here we have a box where the AI is giving constantly useful information for the radiographers, how to adjust, how to improve the quality of the pictures. It's like having ChatGPT integrated in your scanners. Very cool. And the reason why I think this is particularly interesting, as I mentioned previously, is because it can work very well in different scenarios. In the standard clinical scenario, in the remote scanning, it will work very well, I believe. And also for education, because this is like learning, a constant learning meanwhile you're scanning, because you have a constant feedback on the quality of your scans, so you can improve all the time. So that's why I think this will be particularly interesting. And yeah, this is the AI box that can give us some very useful information. Let's see another interesting application, which is the artifact reduction. When we have exhausted all the options and we still have issue on the images, despite improving the scan time, the breath holds, and having a constant feedback with the AI can automatically improve the artifact. Here we have a comparison. This is quite easy to understand. This article compares the GRASP, which is another mathematical reconstruction that combine compressed sensing, parallel imaging, and golden angle radial sampling, with the UNET, which is our AI algorithm, with different breathing techniques. We have the breath hold, the free breathing, deep breathing, and we can see in all of them, we have a certain degree of motion artifacts that is automatically corrected with the integration of the UNET. So scanning CMR patients every day, I do have situation where I do my best, but still the quality of the picture is not perfect, is not particularly good. In this situation, the AI, I believe, will be a very helpful tool because it's automatically fixing the artifact, improving dramatically the image quality. Another interesting application is about image reconstruction. In this example, we have a CMRA of the heart. On the left top corner, we have a low resolution acquisition. On the bottom, we have a bicubic interpolation, and the quality of this picture is not particularly good. On the right top corner, we have a high resolution acquisition. We can see an improvement on the quality of the images, and this is our reference. And at the bottom, we have the AI super resolution. So what happens with the AI super resolution that is obtained mainly combining the GANs and the CNN that I discussed previously? We take the low resolution acquisition and we upsampling, integrating the AI algorithm. So we can see that with the upsample of the low resolution acquisition, we have an improvement in image quality that is comparable to the high resolution acquisition. So you may ask, so what's the deal? Why we don't just use the standard high resolution acquisition? Well, the main difference is that to obtain in this, at least in this particular case study, we have the high resolution acquisition that is obtained in about 7 minutes, whereas the super resolution reconstruction, which has similar features of the high resolution, is obtained in about 50 seconds. So there's a dramatically improved time, reduced time. And the quality is pretty much the same, if not superior, with the AI. So let's see some other interesting example in the reporting process, because AI can be very helpful in this part as well, in this step. Again, working in the CMR field, I often see the necessity of having urgent reports, and AI can support the radiologists in many aspects. I think one of the most interesting one is CMR segmentation. This can reduce the time and the cost, limiting variability and improving the accuracy of the diagnosis. Also, if you're doing a patient that requires a very urgent report and your cardiologist is busy, AI can speed up the whole process. As I mentioned previously, AI algorithms are capable of learning to recognize pattern And in this case, we can see the AI is able to outline the contour of the left ventricle. We have in this article, let me show you a bit better. We have a comparison between the ground truth, which is the green you may see here, which is the segmentation done by the cardiologist. The blue is the prediction done by the AI algorithm, and the red is the overlap, meaning that with the red we see what is the similarity between the ground truth and the AI algorithm. And we can see that they are pretty much very similar, meaning that the AI is able to predict the segmentation that otherwise done by the cardiologist, and it goes the same with the flow. So AI is able to do all these measurements automatically, improving the speed of the report. And I think this will open up some very interesting opportunity for us as radiographers as well, because we are already doing reporting in a way, and AI will help us to do a sort of pre-reporting. But we can discuss about this a little bit later. This is another example of CMR segmentation. The AI is able to do many measurements automatically. I put some numbers here to compare the segmentation done by the AI and the manual segmentation, and we can see that most of these numbers are very similar, meaning that AI can segment as well as a cardiologist. Another interesting or very interesting application of AI is the opportunity to perform scans without the contrast, or otherwise saying obtain the same information without the need of use contrast agent. And the way that is done is by combining T1 mapping with AI-generated enhancement. There are many algorithms now that can do that. And we can see in this example, if we combine the prediction ability of AI, so basically we train the AI on late gut images, so the AI is able to predict based on the information given by the T1 mapping where there will be an enhancement in the late gut, or it will simulate the enhancement of the late gut. And we can see that in the AI quantification process and in the late gut quantification process, we have information that are quite similar. In some cases, actually, the AI can detect better than the late gut. But of course, we need more studies about this. But I think this is a very interesting application. If we have a patient with low eGFR or a patient that has allergy to contrast, for example, this could be very, very interesting. Let's analyze generally the workflow to see how AI can improve the whole of the process. This is a very nice and easy diagram where we can see, starting from the patient checks, the AI will be able to work with the wrist to retrieve very useful information, for example, the eGFR or others that are crucial for the CMR examination. We have seen how AI can support us in the planning process, giving us constantly a feedback to see how we can improve the image quality. We have seen how AI can support the patient in the acquisition process, reducing the scan time and the breath holds. Eventually, I believe we will be able to remove completely the breath holds. And we have seen that AI can have a very important role in the post-processing as well and in the reporting phase. As I mentioned at the beginning, I would like to expand this a little bit more because there are many interesting things to say. And I'll just brought you some more example of the integration of AI algorithms outside the CMR sphere. We have a very easy example here of a shoulder. We have a claustrophobic patient moving during the scan in this situation with a coronal T2 weighted fat suppressed image. we can see that there's a lot of things that are wrong with this image in terms of image quality. Image is noisy, there's motion artifacts. We can see partially the lesions or the inflammation, but the quality of the image is not particularly good. By simply having the integration of an AI algorithm, we can massively improve the quality of the image with a better contrast to noise ratio as well, with the reduction of the artifact, which can be performed also in virtually any kind of MRI examination. So by simply using an algorithm, we can improve massively the image quality. And I think this will be very interesting in the MSK field, because we do have patients in pain most of the time that are moving. So having AI algorithms that can reduce automatically the artifacts and improve the image quality will be crucial, I would say. Another interesting application is in the neuro imaging field. In this example, we have AI software called NeuroQuant that can automatically segment the brain. And there's a comparison between the standard MRI acquisition of a 3D T1 weighted sequence compared to the 𝐷L, which is the AI algorithm. And this software is telling us that the volumes and the quality of the picture is very similar, meaning that the 𝐷L can obtain a high quality picture as well as the standard 3D T1 acquisition, with the caveat that we have a almost 40% scan time reduction, which is quite useful, especially in the neuro field, if we have old patients for research or patient with Parkinson or other diseases. And the same AI algorithm is also able to detect better the lesions in the hyperintensity area, in the flare imaging. For example, we can see at the top that the standard MRI acquisition with the software is missing part of the lesion. Also, in the panel C, we can see we have an improvement in terms of artifact. As I shown in the CMR, we can improve the reducing the artifact, the quality of the images. And we can see that in the AI algorithm applied images, the quality is better. There's a certain degree of artifacts around the lesion that is automatically improved by the AI. So we can see how we can apply the same AI algorithms to any kind of MRI examination, and we have a massive improvement. So this is another interesting one, just to show you the variety of the application of the artificial intelligence in our field. There's a lot to say about this, but I believe we would need another webinar for this. For the safety area in remote scanning specifically, we can use cameras with AI integrated algorithm that are able to detect objects that could potentially be dangerous in the MRI environment. So thanks to AI, we have real-time object detection. Here we have an old patient with a walking aid. The AI is analyzing this object, and according to the training will tell us if this is okay or not. Very likely not. And we have automated safety alerts, constant monitoring in zone 3 and 4. This will massively reduce the human error, because the same way as the planning part, we have a constant feedback with the AI, and the AI is telling us what could be wrong in this specific scenario. And it's an easy integration. So this is another particularly interesting application of AI, because safety, we need to work more. And I think AI will be very helpful in this. Let's discuss, to conclude, a little bit about our future as radiographers, because there's a lot to say about this. I hope we will have the time to discuss about our future, considering the advent of AI. There's a paper I've been reading recently that is doing a survey on radiographers, asking what will be the impact for us. And there was a question specifically, there will be a modification in the responsibility of radiographers because of the use of AI. And then I will ask this question to you guys maybe later to see what is the opinion of all of us about this topic. And in this paper, there was a 67% agreement. So the majority of people agree with the fact that there will be a shift on our responsibilities as radiographer. 12% was neutral, and 21% disagree. And I put this example because I think is represent what is currently the reality about the topic. The majority of us are aware about AI, and we are aware that something will change. Some people still disagree with that. They eventually will change their mind, I believe. But the thing is that I think new opportunities will rise with the advent of AI. I don't see AI as a threat, but I see AI as an opportunity to improve our skills and evolve as professional, because it will be a new technology that will be part of our life. So we will need to become expert on this technology. We will performing quality assessment. We will be working in the research field potentially to develop these AI models that can support us in the scanning process. And as I mentioned previously, I believe there will be also opportunity in the reporting area with the support of AI. And if you don't believe me, I'll show you some of the roles that are already out there. And you can go to Google and apply of each one of these: AI imaging workflow coordinator, radiographers that are working alongside radiologists and IT teams to integrate AI in the imaging workflow, AI training data curator, clinical AI educator. Of course, we have to become expert of this technology applied to our field and train the new people coming to understand how it works, how it's applied, how we can improve it. Also AI quality assurance and AI research radiographer. Since we will have a lot of AI algorithms coming up, is our role to understand how to develop these AI algorithms, because we are the expert in our field. We know how to use the machine, we know what needs to be improved, and more. There are, of course, limitations to this study, and then I'll conclude in a few minutes. The problems are that the studies use a small or non-diverse enough data sets, so it's difficult to generalize the findings. For example, we have some studies that focus on only one scanner, maybe just Siemens, or only one sequence. So therefore, it's difficult to use these AI algorithms for all of the scanners, all of the manufacturers, all of the possible sequences. Some of the studies that I've read, they were focusing only on motion artifacts. So what happens if we have another kind of artifacts? Will the AI algorithm work the same way? It's difficult to say. I believe we need much more studies. We need to understand more this very interesting technology. But so far, we have seen that we have a very good potential to reduce the scan time. We've seen how we can improve the scan time, reducing the breath holds as well. The image quality assessment, I think, is a great thing. The fact that we will have the AI supporting us all the time during the scan, eventually even recognizing the lesions in the images, giving us some useful information so we can understand how to identify the lesion, what protocol to use in a specific scenario where we have a specific lesion, automatic artifact reduction, fundamental if we have exhausted all the other options, and image reconstruction to improve the image quality, reduce the noise, and optimize resolution for high quality images. I would say all these things will improve the general workflow. And I put a very interesting picture at the end. I call the AI wheel because I think it represents really well what is the situation at the moment. We have the progress of AI with all of the things that we have listed previously: motion correction, artifact correction, resolution enhancement. We have the opportunities arising with the new technology, like data integration, image interpretation, deep learning signatures, a lot of interesting things coming up with the new technology that will be interesting for us as radiographers. But we do have challenges as well: standardization, accountability, and more. So at the end of the day, I think it's really up to us. We need to be the one leading this change because, as I mentioned previously, we are the expert in our field. And if we are smart and if we understand this technology, I think especially combined with the remote scanning that we've been discussing in other webinars, which I believe they will be the new two pillars for the future of radiology: remote scanning and AI. If we lead this change, we can reshape our skills and evolve as professional. And that was it from me. These are all the articles that I've read in the past year, quite a few of them. And thank you for listening. It's been a pleasure to present this work. Any questions?
Thank you very much, Daniele. I think it was an amazing presentation. I actually resonate a lot with what you just said, that the profession is on our hands, basically. So I really agree with this, and we talked about this on remote operations as well. And I don't want to bring this about remote because it's about AI and cardiac, but I agree with you that the pillars of our profession in the future will be on remote and AI for sure. I have one question, and then I'll pass to people that have questions. And I know Julian has some really nice questions. I just have one that I would like to start with, which is the fact that, do you see any possibility of these AI agents that people are talking about influencing the way we work with cardiac MRI or MRI in general? Do you think these AI agents will play a role in the future in what we do?
I think so. I think especially in the planning process, as I was mentioning before, the opportunity of having the feedback from the AI, and I think this will be extremely helpful for us to organize the workflow, especially in understanding what is the best protocol for any specific examination. So the AI will give us very useful information, and with the organization of the workflow, we will be able to improve many aspects. So using the AI agents will be very helpful for us to organize the department, understanding what protocol to use, what are the best decisions in the department. So I would say the AI in this context will be like of an extra manager that can help us in optimizing the organization of the workflow.
Perfect. Thank you so much.
You're welcome.
I really like the metaphor about the manager. I think it's pretty nice.
It's good to have one extra manager, isn't it?
I have a question for you, Daniel. I think you mentioned in some slides about also the auto planning using AI. And I don't remember if you mentioned this specific algorithm, but I came across some paper about a new algorithm which is called EasyScan, which is like a vendor provided. Don't want to say which vendor, but the performance of this algorithm are very good. Apparently can beat any kind of like manual prescription of the slice in cardiac MRI. It will be faster. So it seems we are moving towards that direction now, the auto planning in cardiac MRI. which is going to save a lot of time and probably reduce also a bit the complexity of the scan. So my critical reflection is, if we kind of like partially take away that task from the radiographer, meaning planning cardiac MRI, admittedly, we remove like a huge task from our like routine. Let's take a cardiac MRI radiographer that do like 10 cardiac MRI in a day. Removing the planning would be changing completely, revolutionizing probably the workflow. So how do you think would fit the routine practice of a cardiac MRI radiographer, this algorithm? In what kind of like way we can use that time from a patient care perspective?
Oh, it's a very good question. I read the article, the 𝐂𝐫𝐿 one, and there's also some very interesting information about the shimming volume. I think they can automatically position the shimming, which is another helpful aspect, of course. And yeah, for sure, we will be taken away from the planning duty, let's say, and this will open up other opportunity. As you mentioned, we will be having the opportunity to focus more on the patients. So we will be improving the patient care, but also the general administration of the workflow. Some of us, they already do that. I believe in most of the departments, the lead radiographer is managing the post-processing, emails, and other aspects. So we will be basically overseeing the process. We will be focusing on other tasks, improving the general workflow with improved patient care, and maybe this is a bit of a guesswork, but I believe that there will be space for us in the pre-reporting area as well. Speaking about CMR, I believe that we could, for example, work on the segmentation process after taking the pictures, since we have, more skills to develop and more time to use. So I'm very enthusiastic about all these new opportunities, and I'm very curious to see how our profession will change in the future.
Daniel, there's also someone on the comments, Jennifer, asking if you think AI will. She's not asking. She's saying that she's not sure that AI will beat manual prescription of slices, especially on congenital MRI. She says that maybe not now, but in the future, possibly. What are your thoughts on that? Because congenital, as pretty much everyone here probably knows, it's not just going there and plan it's easy, because the congenital part is what makes cardiac a little bit different and difficult for radiographers to learn it. So what do you think is the role of AI today with congenital, and the role of AI in, let's say, in the next 5 years?
Yeah, I agree with the fact that it's a bit early for the AI to take over in this kind of quite complex examination. But I think, as I show in the artifact detection step, it will be a very helpful support for us. Especially, I think about the radiographers that are just starting doing cardiac and they don't have the expertise of other radiographers. Having the AI that can just support us is a very helpful aspect. So I think at the moment we will be still doing the scan ourselves, especially the most complex one. But having a support from the technology, especially the AI, is something that is a massive improvement, I would say. In the future, possibly the planning will be managed mainly by AI, but we will have other opportunities. We have to change our role, to evolve according to the technology. That's, I think, is the key point. And I think this is good that we are discussing about this. We are doing these webinars because we have to understand the new technology and we have to understand how to move accordingly to the new technologies. So that's why I see many opportunities that are maybe not out there yet, but there are.
Yeah, I'm sure of that, and I appreciate you coming and talking about these things, because, as you said, we need to have the conversation before the tech actually hits our scanners, and then it's too late for us to adapt, because I believe we have to adapt every day. That's why we love MRI so much, because every day is different. We know already there's we have this kind of technology for a while, a few years back, where you can plan basically a cardiac scan with 1 or 2 clicks already using AI, or what they call AI. We're not sure if it's just automation, but you can already do that. Do you think that's something that is coming with for congenital soon, or you think it's gonna take a while still to get there?
Can I jump in on this? Because I think meaning that I don't want to steal the answer from Daniele, which have his views, but what I see is that at the moment the only barrier is the fact that obviously an algorithm is based on training data. For cardiac MRI, stress perfusion, you have patterns, so it won't be that difficult, to replicate blending. The real challenge of congenital is the fact that there are some complex anatomical scenarios that at the moment perhaps there are not enough data to feed the algorithm to say, okay, you can precisely copy that planning on that anatomy. But I think it's just a matter of time, and this is my personal view. I'm not sure yours, Daniele. But yeah, saying that not now, yes, is correct, and I totally agree with Jennifer. But the fact that it's coming is undeniable because it's just a matter of like literally feeding an algorithm with the necessary data. For sure, there will be the need for the radiographer to kind of like supervise the algorithm because you might get it wrong, but we are just looking for more data. And this is my assumption and my take, what we need at the moment to do that step.
And if I can just add, if it gets wrong, the AI algorithm, then we have to still know how to adjust and eventually take over. So it's not like we have to forget about all our skills in planning. We actually need to be expert, because if something goes wrong with the AI, we need to take over and we need to know what we are doing.
Do you think there will be a room for complacency? Let's say you trust your AI algorithm so much that you kind of let it plan and you just go with the flow. Do you think there's a room for that in the future? Because we get so used to, we did 100 scans, and for 100 scans it was correct. So why should I doubt the 101? Because my algorithm is so good, I trust it so well. Is there a risk? You believe there's a risk for a radiographer to just trust it blindly?
I think so. I think is a potential danger if we are blind and we just let the AI do all the things. That's why I think the quality assessment will be a huge area in the future in the AI quality assessment, and it will be our role as radiographers to assess the quality of the AI algorithms and to understand if the AI is doing its job properly. So all of these problems are actually open up new opportunities for us. So that's why I think this future with the AI is interesting.
I agree 100%. I think there's always a room for a new job, as you're saying, because that person, as you're saying, is another manager. It's kind of a supervisor. You become a supervisor of the module that you're using. Julian, you touched on something that I think is really interesting, which is the data that we collect to train these modules. I always have this question for people that talk about AI because I think it's really important. Because when we're scanning, for example, a person from Portugal is very different to scan a person from Angola, where my father is from, or to scan a person from Asia or America in terms of demographics, in terms of their biome. So everything is different for the different races as well and ethnicities. So how do you assure that the algorithm that you're using was trained on the data that you need for the cohort of patients that you scan?
Yeah, that's a tricky questions. And in fact, I put this in the limitation because it's actually challenging to have all the information, to have such a huge data sets that then you can apply the findings in any circumstances. I think probably is the biggest challenge in the AI world in terms of training the AI models, is collecting information and organize the training to make sure that the findings will be applicable to any possible scenarios. So there's still quite a lot of limitation in this field, I would say.
Perfect. Thank you. Because that's always one of the things that worries me.
Yeah,
That the training data is not the equivalent to the patient that I have on my table, and then I'm going to have something completely different than what I'm expecting.
about this is also one of the potential limitation at times of systematic review, which is Daniela did a fantastic job, but collecting and finding the overarching themes and findings. It's difficult because, as Daniele said before, maybe one study is done, I don't know, like on a sample of British, from 25, 35 years old, young people, males, and then the other one is done on a completely sample. So you try to gather all the evidence, but it's difficult to find, that kind of like unique truth in a way.
Absolutely. Also,
We
that
have,
oh,
sorry,
sorry.
Daniel, go ahead. Go ahead. No, sorry.
An interesting thing is that in most of the articles, they use different measurements. So it's difficult to compare them because they use different metrics. So there are a lot of variable, as you said, Julian, is challenging. I agree.
And I think also for managers or for people that are managing the department, they're not always radiographers, but most of the times they are. It's hard to choose one algorithm, right? Because you have so many coming from so many companies, so many vendors. How do you analyze that? How do you approach that situation where you're presented with 5 different algorithms that promise you quicker scans? How do you choose one?
Oh, that's even trickier as a question because
I'm not doing it on purpose, I promise.
Oh, no, it's fine. It's fine. I think it's interesting because we are seeing, for example, if we speak about, for example, ChatGPT, now we have Grok, we have Copilot from Google, and sometimes I like to play games, meaning that I ask the same question to them
Mhm.
and I see the answer, which is slightly different. And this is, of course, because of the different training they have received. So it is challenging to choose the right AI algorithm. I think it requires a lot of knowledge, a lot of research and investigation to understand what is the ideal AI according to one department or one specific clinic. It is challenging, absolutely.
I think you say the right word, which is research, meaning that I'm thinking about what we touched base so far, the auto planning. What they did, they took together 4 algorithms, they combined it, they did like a sort of like systematic kind of like evaluation, and then they checked the performances. But even that, of course, is not the final truth, but it is the only way. Trying, comparing different stuff, comparing performances. So I think research, that's the best way to get some findings and some ideas of how things will be shaped in the future.
Yeah.
Julian, you touched about auto planning. I think Manuel Conte was asking if Daniele prefers auto planning or he still does his own planning on his cardiac scans.
Well, thank you, Manuel, for the great question. I actually still prefer my manual planning because I trust it more at the moment. Maybe later I will let AI doing the things, but I've been doing CMR for a while now, and I like my planning, let's say.
It is good. It demonstrates you're critical, with AI, which is all
Okay.
at this stage. You need to be very critical and say, okay, AI does it, but I can do it better. There is a fantastic question, Daniele, actually, and I want to say thanks to Roy, which I think he says how AI in CMR can be helpful in pacemaker patients. And I think there was that fantastic slide about remote scanning. Obviously, here Samuel can open not a chapter but an entire book about the discussion. But there was a very nice slide about AI to detect potential objects going in and out from the scanner, and we know how important it is these days. We heard about what happened, so how do you think AI is going to fit like CMR in pacemakers patients? Like, of course, from an image quality point of view, can be highly beneficial. You mentioned about artifacts. Do you think from a safety perspective as well, this can be quite useful perhaps to prevent any incidents?
Oh, totally. I think it will be very helpful. We can integrate all the AI tools. As I mentioned in one slide, there are already a lot of AI algorithms working with the RIS, so with the patient information. So AI will be very helpful for us to retrieve like useful information for the patient. So we will be able to speed up the safety process, making sure that the quality of the information is reliable. This is actually another thing to discuss about the reliability of the information. But if you have an AI model you can trust that has been trained properly, that is able to retrieve useful information, I think will be extremely helpful to have all the data you need to make sure that the patient is safe to be scanned. So I think it will be a great improvement.
Thank you.
Yeah, we're talking about safety, and we are in the safety week, right? And I agree. I think AI will be a key in terms of how we face safety, not only how we research implants, like we have Nord Insight and other platforms like that. And Philips also has a very good WeScan. I think it's not WeScan, he has another name. WeScan is from Siemens. They have these platforms where we can research these implants. They are AI-based algorithms anyways, but I think they will become more practical. It's not something you're gonna just search on a platform. It's something that it's gonna happen around you, as you were saying, with the cameras and everything. I think it will go even further than the cameras with actual inbuilt wall or door detectors and things like that. I think that's the direction people are moving in terms of developing these tools, but I 100% agree with you that AI will be a big player on MRI safety for sure. And MRI safety is in desperate need of a reform in every single aspect that we can think of. But yeah, I believe this is one of the directions that we're going through. There's also a question here from Roberto Paes, is asking what's your view of vendor-specific AI solutions versus agnostic AI solutions in terms of quality assessment, image reconstruction artifacts, and false positives or false negatives?
Well, that goes down again in the training process. Of course, manufacturers will have a specific training process, and they will have to sell their products. So I would reinforce the idea that it's always important to do your own research on the algorithm to understand what the algorithm can do and what is the quality. So far, I think let's say the algorithms that are built outside the manufacturer are more interesting because they're more like neutral. There's just in some of the articles I could perceive that there was a team of people actually interested just to develop something, not selling a product. Is more about the development of a technology. With manufacturers, you also have the component of selling an algorithm. So there's more variables in play, let's say, in the game.
I can
So
see
it's fair to say that you lean more towards the
I,
agnostic solutions, yeah.
I would say so far. Yeah.
what you mean, because if I am manufacturer A and I see that manufacturer B has this amazing AI tool, the day after means, okay, now I need to step, I need to play that same game, I need to have the same technology, so let's try to have one as well. While if you're independent and you're a researcher, you say, okay, I want like a nice project, maybe for my PhD, I will combine and then we'll try to get out with a nice independent algorithm that maybe I can sell later on. But yeah, it's quite interesting. I can see your point of view. We
Yeah.
got another very interesting question actually. This comes from a student, I think, which is asking how AI is actually used in real MRI workflow from scanning to diagnosis. I think you touched base on this already during your presentation. But they are also asking what areas I should focus on first as a student. So what kind of like advice would you give as a student? Like she's doing, I think, a degree in medical imaging, and I think they're hearing a lot about AI at the moment. So what kind of advice would you give to a student which is approaching medical imaging for the first time and start hearing a lot about AI, stuff like that?
I think will be interesting. Of course, is good to see the application of AI in our case on the images, but I've been reading a lot about the architecture of AI and the understanding of the technology itself, because we speak a lot about AI, but there's a lot of, it's quite a complex topic and there's a lot of things to learn. So I think will be interesting to actually understand the technology, understand how it works. I spoke recently about the convolutional neural network, and the more you go in depth, the more you understand the potential of the AI. So I would say understanding the technologies first, and then see what kind of application it can have on the field.
Perfect.
I have one question for Daniele, but it's just a teasing question. Okay, it's not something that we're doing. It's something that I spoke about before, and I believe it's the way we're going. In the near future, not in the near future, in the future, do you see a way when AI is simply taking the raw data of scanners and without having a picture, create a report? If that happens, which I believe it will, because we already have some research done by some Chinese company on that field. If that happens, what is our role? How do you envision the role of the radiographer in that specific scenario? That of course is very bleak. It's a scenario that might never happen, but people are talking about it, where AI takes the raw data before the Fourier transform into an image. So they just take the raw data and already give you a diagnosis. Where do you see us playing a role here?
Yeah, I think I saw on LinkedIn this post and I found it very interesting because we are basically eliminating the pictures and we're just analyzing the raw data as you said. And it I think is an interesting future and is quite likely because at the end of the day we want to obtain information. The images are just just a tool we use to interpret the information. So in this distant future, hopefully, I think we will be a different profession, I have to say, because we will be evolving so much that is challenging, maybe at the moment to say what will be our role, but I think it will be such a different future that we'll be focusing on other tasks, maybe more in the development of the algorithm, more expert of the technology rather than working in the clinics. But we already are when we work as application specialists. So at the end of the day, we are a beautiful mixture of being expert of technology and working in the clinical environment. Probably we will be leaning more towards the expert of technology, but having a background in the diagnostic imaging will be helpful for us to develop these algorithms, knowing what is the practice, knowing how it works. So yeah, that's
Like
my
I laugh because Samuel is always one step ahead, meaning that when he says this type of things, he shares them like very generally, and the community thinks, "Oh wow, does this exist actually?" For those that are following the podcast, I think Sam, you mentioned something about the possibility to get one single modality, which every time he says that, I love it because I think when someone here like CT and MRI, X-ray all combined, people will get, "Oh my goodness, this is crazy." But
We're gonna call it something else for sure, but
it,
it's coming.
it is good to have this type of conversation because we always need to discuss about the concerns, and there are a lot of concerns arising from this. I do understand why, but we need to acknowledge that this might be a possibility. So we need to be ready to tackle it. Otherwise, we always remain astonishing and saying, "Oh, this definitely not is going to take place," rather than having our own opinion and how to face those challenges, answering from a governance perspective, from an ethical perspective, how it's going to change from a patient care perspective. So we are those that needs to kind of like provide feedback, not against, but like also raise concerns where they apply.
yeah. And if I may,
Better ready than sorry.
oh sorry.
Again,
Better ready than sorry.
exactly that. What else do we have here on our beautiful chat? Oh, you see, you got already some potential argument or not criticism, but Jennifer has a very good point. Cutting out human input and just relying on AI working out a diagnosis from raw data is quite a slippery road indeed.
I agree. I agree. I'm not the one doing it. I'm just the voice of what's going out there. From what I read from some articles from a Chinese company, they're actually mixing different like eye testing with MR and some other modalities all in one thing. And then there was another company just trying to get raw data before the Fourier transform to basically create a report of what with the LLM create a report of that data. if you think about it, we only do the Fourier transform so we humans can actually look at the pictures and try to make sense of it. If we have AI and agents and AGI and super AI or whatever they call it nowadays, they will be so more intelligent than us. These AI agents won't need images to basically diagnose the data that they acquired anyways. So that is where this thing is coming from, because the images are there for us humans to look at. That doesn't mean that we're not going to supervise it, as Daniele was saying. It doesn't mean that we're not going to train these modules. It doesn't mean that we're not going to be there to correct their mistakes. I think that's still far ahead in the future. But as you're saying, Julian, we need to be ready before being sorry in the future. So I think we need to talk about these things, understand what's going on, so we are prepared if these kind of changes actually occur in the future. So that's my point of view. It's not me creating this. I'm just the messenger.
I think it's a very valuable point actually, and I think this ties perfectly with another question, which I think then is a perfect ending also for our webinar, which I think was very informative. Thank you, Daniela. And he says, from Raul, he says, with AI increasingly involved in scan planning and reconstruction, is there a risk that radiographer might lose their hands or technical expertise over time? How do we maintain critical scanning skills in AI-driven workflow? And I want to tie this also with what Jennifer was saying, and she's just the last message. She's saying, I suspect our role in the future will simply be quality control, which I think is that the two things are tied together. One message mentioned losing skills, and the other one saying, okay, we just need to control what the AI is doing. So I think the two things are essentially tied together. Do you think is actually something real possible, losing skills in favor to just getting different tasks like just controlling quality, making sure that AI do things accurately?
Well, I think the best example is the new roles that are coming now about labeling. So I think radiographers will be working a lot labeling images. So we'll be have a quality control assessment on the pictures, because in the training process, we want to make sure that the AI is actually able to recognize the anatomical structure, that is understanding what it's doing. So I believe in a way we can maintain our skills, probably in a different way. Supervising AI, we need to know if the AI is doing well. So we need to have the knowledge still. So it's like supervising your child. When you do the homework, you know what you're doing. You know, you're telling the AI if it's doing right or wrong. So we need to have the knowledge. We'll definitely keep our skills as well, I think. We're gonna do less of the tasks we are doing currently, but it's really up to us. You know, it's up to us to keep ourselves updated, to understand about new technologies, to maintain the skills. Is something that we have to do as radiographers.
Can I add one thing? I think maintaining our skills is the mistake, because the MRI and the field of radiology, it's evolving every day. If we maintain what we have, we're always going to be lagging behind. I think we have to evolve with it. And our skills will probably be completely different because we need to evolve with those skills as well. So we might acquire different skills, and that's what we should be thinking. Because if we keep thinking, I'm going to maintain my skills, I want to plan forever, I want to be able to always look at these images, we're going to be left behind completely, because we're not going to be doing that in 10 years. We're going to be doing completely something else. And I believe it's a figure of speech, will be the person that will not have that job anymore, because you want to maintain those skills, and those skills are not used anymore. So I think it's a matter of keeping up with what's coming and learning and researching and trying to enrich your knowledge as much as you can. That's my point of view. Free to have people disagreeing with it, but that's how I see it. That we always have to learn and learn and learn. I think Tobias said in one of our podcasts that what he loves about MRI is the fact that he can live 3 whole lives and he will never know everything about MRI. And I think that applies perfectly here, because in 15 years, we will know nothing about MRI. We'll still be learning about it. So that's my perspective from that conversation.
I do think it's great perspective. and actually respecting myself, because I think that's the attitude. But maybe just to be a little bit critical about this, sometimes different places, different countries might go at different paces as well.
Yep, yep.
For if someone is thinking from like a completely different part of the world, my concern at the moment is learning cardiac MRI and how to plan and how to do properly an exam. I don't think should too much concern about what AI is hiding and about consistently getting thinking about upscaling those skills in terms of, oh, I need to get ready for AI. Meaning instead, if you work like in a massive hospital where AI implementation is like the speech of every day, and we're going to change the scanner, we're going to upgrade it with this, then you are required actually, to be on that level.
Yeah, yeah, yeah.
That just my only comment about your absolutely legitimate view about
No,
this.
I agree with you. I agree with you for sure. I think there's one more question, and probably we'll start closing. We have normally 1 hour and a half, so it's 9:20. Jibin is asking, can AI, in any chance, will reduce the use of contrast media mount in CMR or act as an alternative? I think we already see these kind of things happening where we do scans without contrast because we have AI algorithms simulating that. But Daniela, you're probably the best person to answer this for sure.
Yeah, I think I put in one slide the opportunity of using T1 mapping together with the AI generated enhancement. So it is all about training the AI to predict the presence of scars. So what we do, we just give a lot of information to the AI model about late gut enhancement images. So the AI learns how to recognize the pattern and understand how to predict the lesion, the scar, with the information of the T1 mapping. So I am quite positive about this. I think it will be huge in the future, the contrast-free scan in CMR. We do have a lot of patients every day that cannot have the contrast for one reason or the other, and I believe this will be a massive improvement.
Perfect. Before we closing, there's one thing that Jennifer she's saying, in fact, even so-called first world countries, CMR is still a steep learning curve, which I agree. We battling with that, and that's why we at Everything MRI also created something about cardiac, and I'm going to share with you guys as well because I believe it's extremely important, which is our MRI course as well. Cardiac MRI. We talk on this course. Probably Julian will be the best person to tell you about this. But we also talk about AI in this course, right, Julian? Can you just enlighten us a little bit?
So also like a module about innovation. We talk about like few things, few new sequences. So there is quite a lot to say. We talk about congenitals, which we have, I think, couple of modules about congenitals, exactly for what has been mentioned here, meaning that auto planning is a very nice thing, but as someone suggested, congenital is still completely on our set of skills. So that hence is critical, to be honest, to get those type of skills.
Perfect. So guys, if you want to learn a little bit more about cardiac MRI, just take a picture of that QR code. We have a lot of experts there, people from different hospitals, public and private in UK, and not only UK. Julian is one of the lecturers as well, so you will see some familiar faces there. We have one more webinar, I think is 30th of September. Julian, correct me if I'm wrong.
Davide Fierro from ITEM, which is gonna tell us a little bit more about synthetic MRI and innovation about MRI. So another quite, I would say, fragmentic topic, meaning that when we hear about synthetic MRI, it's like, is this really a thing? Is it actually real? So he's gonna tell us a little bit more how it works. And if you have any questions, guys, that would be the right moment to ask them.
Perfect. So I want to just take one moment to thank everyone to be here this late today in a summer night, at least here in Europe, as Julian was saying. Here in Portugal, it's 25 degrees at this moment, so it's a bit hot. So thank you very much once again. Daniela, thank you very much for taking the time and for building this amazing presentation and for answering these questions. They are very pertinent and people love to talk about this because we need to evolve as a community and not just as an individual. So thank you for playing a role there. I really appreciate what you've done for us today and for the whole community in general. And of course, thank you, Julian, and thank you everyone that normally comes to see our webinars. We reach almost 100 people, which is amazing. So thank you very much for all. I'll leave Julian and Daniele for the last remarks.
I will leave it completely to Daniele, to be honest. The CEO. So thank you so much, Daniele.
No, again, I would like to thank you, Samuel and Julian, for giving me this opportunity. It has been a challenging year, working a lot on this project. I also had the pleasure to present this at the 𝐂𝐞𝐫 in June in Liverpool. It was a slightly different presentation. Today, I decided to expand a little bit more on the AI because it's a very interesting topic. And thank everybody that is connecting and listening tonight. It was a great pleasure to be here. I'm very happy to have the opportunity to share my project.
Thank you.
Guys, have a nice evening, and I hope to see you all in 30th of September.
Thank you so much.
Bye-bye.